Hi, this video is the art of hair transplant restoration surgery on a client who has a receding corner, and it's like an M-shaped pattern hair loss where he comes up, he comes down. If we're going to show the audience this way, and we pull the hair out, and this is how thin his hair is, and you turn this way, and see how significant thin his hair is. But you see how when I draw the hairline, it flows down and it's continuous. Hair transplant, as I mentioned in many of my videos, is an art form. It requires a lot of the artistic and aesthetic detail to ensure very natural result. So we just don't put draw and have it put two corner of hair there, and hopefully it will grow. When you do the hairline, it has to flow, and again, it's an art form. It requires a lot of the artistic and aesthetic detail. So on average, from the mid eyebrow to the hairline for Caucasian, around 7.5 to 8.5 centimeter. For Asian and black, is around 6.5 to 7, and for Hispanic, it's somewhere around 7 to 7.5 centimeter. And once we get the average height, we use the average height of each ethnic hairline as a guide, but when we build the hairline, we build it according to each individual facial structure. Once we get the average height down and we get the shape down, and the more narrow the face, the more arch back the hairline. The more round the face, the more flat the hairline. And you can see I drew down here, even though we don't have to come down here, but we have to make sure that it's continuous and it flow. And that's how you create the hairline. And then once you have the shape down, we zigzag through. No hairline straight. The two type of hairline. The bigger zigzag is the softer hairline. The tighter zigzag is, a smaller zigzag has a tighter hairline, it's a sharper look. Or you can go in somewhere in between. And then we will transplant a very precise angle, 35-45 in the front, increases when you go backward, and changes when you go a different direction. And then selection of hair graft is important. We try and plant rows and rows of single hair graft in the front, followed by a root that grow 2 hair, 3 hair, and 4 hair in the back for bulk and volume. And the other important factor, we're going to attempt around 1,300 to 1,500, somewhere around there. We not only fill in the both corner, but we do some reinforcement as well. The more hair you put in, the more density you will get. Ideally, if I can do all, build the front half, that'd be perfect. But if there's not much space, I can't put the hair in. So the front half of the head is around 2,500. But I start with 13 to 15 is a good number because our concentration is mostly in the corner as of this moment now. As you lose more hair in the future, then we're going to reduce some more. By using Rogaine and Propecia, you can really slow down the hair loss as well. So this is the art of hair transplant restoration surgery on a client with thinning in both corners. We'll be attempting using the FUE method. And FUE, as you know, is the most advanced technology available. It leaves you tiny dots of scar scattered through the back like a mosaic pattern, allow you to wear your hair shorter. And I'll be the surgeon who will personally design your hairline, personally extracting hair 1 graft at a time. That will give you the best, healthiest graft and best density, and making precise angle. So we do 90% of the work, and of course I have technician or hair nurses will help me put the hair in as well. Thank you.